Welcome to Scan Health Can, the podcast where we explore the crucial role of healthcare supply chain. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the chain is crucial. In this episode, Dr. Ann Snowdon speaks with Tony Williams, Senior Director of Supply Chain at Newfoundland and Labrador Health Services. We hope you enjoy this conversation.
I am so thrilled to have a chance to speak with you today in this podcast and to get underway on talking about supply chain and healthcare in Newfoundland and Labrador. Why don't you just start a little bit on giving us some background on Tony? Who are you and what do you do in health supply chain in this amazing province we know as Newfoundland and Labrador?
Thank you, Anne. Happy to be here. It's a great opportunity. Looking forward to discussing this with you. So I'm currently Senior Director of Health Supply Chain or Supply Chain for Newfoundland and Labrador Health Services. And I have been in that role now for 8 to 9 years or so. And prior to that, I was in leadership roles within supply chain, also in the health system, just in a different part of the health system, just part of a Crown corporation focusing on some digital health projects. So certainly been involved in in supply chain for at least 20 years now. So, and I'm actively teaching supply chain, a couple courses at Memorial University of Newfoundland. And so I do that, and also workshops and courses with Supply Chain Canada. So,
fantastic.
So I'd like to promote the supply chain, and the goal is to, start an intake process for those that are interested in the forum or interested in supply chain, because obviously I'm a very, very strong proponent of it in terms of healthcare itself. We have a mantra that supply chain is the backbone of the health system, and everywhere we go, every meeting at either level of the organization, internal or external stakeholders, that is our mantra. So anyway, we try to promote that as much as we can.
Well, Tony, it is such an important mantra that I'm not sure is as publicly in people's minds. When we think about supply chain, people tend to glaze over a bit. But as a backbone, if you don't have a high-performing supply chain that can make sure every nurse, every pharmacist, every physician, surgeon, you name it, has the products they need to deliver care, quite frankly, care doesn't happen. And couldn't agree more with you. That's such a fundamental principle, I guess, of the role of supply chain in making healthcare possible. With that in mind, you are leading and have led supply chain in one of a very interesting province, sometimes known as the Rock. Can you share a little bit about what are some of the very unique challenges we are facing, you in your province and or all Canadian provinces are facing, relative to managing and ensuring that backbone of healthcare is super well in hand and able to deliver?
There are certainly some challenges here on the, as we say, the far east of the Western world, here in Newfoundland and Labrador. And I certainly encourage anyone to come here, despite the challenges I'm about to mention. So we have obviously probably world renowned about our weather and how quick that can change. But there's certainly, with weather comes transportation vulnerability, certainly. For those that, and I appreciate the podcast, is across Canada. So there is a ferry, the Marine Atlantic, that goes from Nova Scotia in North Sydney to Newfoundland and Labrador. And a lot of our medical supplies travels on that ferry. CBC had a story a few years ago about how such a Marine Atlantic vessel got stuck in ice for quite a number of days between that passageway, and people had to be rescued. And on that ship was our medical supplies, or that order. And certainly, as you operate as many of us have done or did at that time, operate on a just-in-time basis, levels were getting a little bit low by the time that ship got out of the ice and unloaded and moved on to our facilities. So anyway, so all of that impacts supply chain for sure. Probably unlike some of our partners and stakeholders and colleagues across Canada who might receive some timely deliveries from say national distribution centers, ours takes a little bit longer getting here. And there's a few other patches to get across once it gets here. Yeah. So we look at things here in terms of looking at that issue and trying to be proactive where possible. So we look at things like buffer stocks and dual routing plans. Maybe if we're anticipating a delay, and we're always watching the weather. So if that looks to be perhaps troublesome on the horizon, we work with our distributors, our suppliers in terms of transportation, and maybe there's alternate routes such as air, which is probably the only other route we can take to get it here. But unfortunately, that of course elevates the transportation costs. But our main concern is just as we say in supply chain, right place, right product, right quantity, right, whatever the 5 R's are. But bottom line is in healthcare, we need the products here for sure. So we do what we can to do that.
Do you think you've had significant number of years in this space, 8 to 9 just in this role and previous. Did anything change around these challenges post-COVID? So we learned a lot of, I would say, hard lessons during COVID as to how resilient or not Canadian health systems are. But given some of your unique challenges, especially on the transportation, weather impact, etc., that just-in-time sort of approach, which was very common before COVID, just have the products you need at the time you need them. Did that change after COVID, after the many challenges we had? And can you share a little bit about how that changed, maybe?
We here in the province, like many listening, felt that shock of just in time is just not working. So
yes.
And we all felt that certainly 5-6 years ago. So during COVID, like most things, to never let a good crisis go to waste, we took that and realized very clearly to be proactive in this is, in terms of public health emergencies. We hope that's the last one, but I doubt it will be. So we need to look at this a little closer. So in the last 5 years, we've stood up 2 distribution centers, within our province, one on the East Coast and one on the West Coast. And in total, you're a little over 100,000 square feet of space. But that certainly includes some of the necessary supplies like PPE and vaccines and some of our more critical supplies. In the event that there is a transportation disruption or supply disruption, and at least we got something there to grab when a physician or a nurse or somebody needs something at one of our healthcare facilities.
Right. And that strikes me, and I've heard this before, you and I've had chatted, you have a very impressive ability to engage your local communities, local businesses. And part of that, of course, was during COVID, but I'm not sure that it was limited to COVID. Can you share a little bit about how have you built some of that self-reliance, given those challenges that you have, by engaging your communities, your local businesses to solve some of these disruptions that you find yourself having to manage?
One of the things we do with our suppliers, and we try to have a local emphasis because we realize that there's a lot of reasons to help and support economic development within our own province. Our division, our provincial supply chain department, has its own strategy. So we operate under a strategic framework within a 3-year time period. So we regularly communicate the goals, the vision of that strategy to our supply base. And we have one of our 4 divisions within supply chain department is supplier relationship management. So that really focuses on supplier performance, supplier development, and supplier credentialing. So we through those regular communications, that dialogue, or that, folks can see, suppliers can see what it is that we have in our playbook, we'll say, and they can certainly make any adjustments within their operational model to, either to maybe diversify or expand further to help meet some of those needs. So that's I think it has been successful. We've had some good positive feedback from the supplier community on that. We also work with our provincial purchasing agency on reverse trade shows. So this is where we get into the community, and we have we host a booth, and this is where suppliers visit us, and suppliers visit us so we can have that ongoing dialogue around, similar to what we do in our ongoing communications, to say, here's NLHS, here's where we are, and here's where we want to go. You're welcome to participate and contribute to that. So we have those on an annual basis, and we've done it here in Newfoundland and Labrador, and we've done it in other Atlantic provinces, because we share a lot of the same suppliers in healthcare.
Yeah. Interesting. So a reverse trade show, normally at a trade show, health systems would go and meet all the suppliers. The reverse, I just want to make sure I understand it, is the suppliers come to all of the systems that need help and support from suppliers. Have I got that right?
Yeah, they come to us. They come to us for that day that we're hosting the show, and that we help them understand better how to do business within healthcare, but also within other sectors of the public sector as well. But so that is that connection point that's so important. So folks know exactly, from a vision point of view, they know what to expect. Yeah.
And so if suppliers have that more deeper relationship with who they are supplying to, much better chance they have of meeting those needs or working towards meeting those needs, which in the case of Newfoundland, Labrador, pretty important given some of your unique needs and location.
100%. And further, just one further point on that is the legislation also supports local supplier involvement, because there's some support there and directives within our policy framework that says, you can give some advantage to local suppliers, and really that advantage certainly comes in the form of evaluation criteria, where they get a bit of a 10% advantage. When you come in, when you submit a bid and you're a supplier here in Newfoundland and Labrador, your price was $100 and the other person's price, was, you get that 10% advantage. And, depending on the type of product you're buying and the quantity thereof, that can really play quite a competitive advantage for sure.
Have you noticed growth or increased capacity among your local suppliers, given that the province has prioritized buy local, for example? Has it had an impact on the suppliers in any particular way that you could share? I know many provinces are looking at the same strategy. Just wondering what you're seeing as a result of that strategy among the suppliers that you work with.
Yeah, we are seeing certainly some uptake, and acknowledging that we do some of these medical surgical products are perhaps unique or need to be manufactured elsewhere. But we also we certainly have some uptake in interest, particularly also in our innovation portfolio. So we have certainly a list of innovation partners, which are, many of those are local suppliers. They're who want to incubate a solution for a healthcare challenge.
Right.
And then we work with them to either say co-build a solution, or they probably get some funding or economic development help from other agencies like the Atlantic Canada Opportunities Agency. Either way, they come to the table, we work with them. So there's a forum there within our health system that allows new solutions to be put forward to identify healthcare challenges. And we're seeing more and more. So we get this roster of innovation partners every year, and we do see that growing. So that's a great indicator of interest. both innovation here and local partner involvement. So that's exciting, very exciting to be involved in.
So it's almost like you're creating that health supply chain supplier, maybe ecosystem. They don't have those products needed today. They are in they have an innovation opportunity to develop, advance, strengthen, to meet those unique needs, because healthcare does shift and change over time. So very
Absolutely.
and would you say that your work with local suppliers, communities, does it also now advance your supply resilience, or is it maybe a bit too early for that? Meaning you're a bit more self-reliant than you might have otherwise been on your, engaging your local suppliers.
I think, we're still in the early days. I think this really was initiated primarily during COVID when we saw,
Correct.
some local suppliers really step up and help support things like PPE manufacturing, for example.
Yeah.
And then that sort of evolved more as the innovation space grew and grew a bit more. And I think time will tell that the real impact of this on a resiliency point of view. But our goal is to do, those sorts of initiatives. We all know local manufacturing, for example, is, I think if you look at things globally in the healthcare space, there's very few countries who are actually manufacturing the things that we need. And I think there could be an opportunity there to support local business or economic development through multiple stakeholder partnerships. And really, even though we're a small province, certainly the economic benefits of exporting products could be certainly a development opportunity here. So like I say, it's early days, but it's very much on a uplifting or encouraging trend for
sure. Making a lot of progress, it sounds like. You mentioned in your reverse trade shows, but I think it goes well beyond it, collaborating and engaging with other Atlantic provinces. The Atlantic provinces tend to, at least on the outside looking in, be much more collaborative across those provincial boundaries, if you will, and work together. Can you share a little bit about what does that collaboration really look like, and what are you finding it's really achieving? Which I think is a lesson for many Canadian jurisdictions, perhaps, to learn from.
No, that is so very exciting to be able to work with Atlantic Canada partners. Great group of individuals. It started really last year, which I guess there's an Atlantic Health CEO table that was activated in 2024. And they were really focused on, I guess the whole reason for that is a strategic forum, really, just advancing that regional collaboration. So they were the real sponsors of this in terms of regional collaboration and looking for health system improvements.
Yeah.
And then what spun out of that about a year ago now, in 2025, were 4 streams of activity, procurement being one of them. So you had digital, nursing mobility, artificial intelligence, data. So, 4, but primarily, well, of course, the one I'm interested in, procurement.
Yes, procurement,
And since that time, and really just a few short months, this team of supply chain professionals from the 4 Atlantic provinces got together quickly and identified, we've sort of had our wish list of things that we could work on. And the first thing that we thought was of early term or near term value was the idea of piggybacking. So piggybacking off each other's contracts or RFPs. If I was to buy something off, ideally, the idea is I would buy off Nova Scotia. If they had an RFP, Newfoundland and Labrador could buy off that quickly. It wouldn't have to go through the RFP cycles or the time required to issue its own RFP for the same products or services. So that's certainly allowable in many RFP clauses and terms and these sorts of things. What we were finding as an Atlantic group was that some of the jurisdictional or bureaucratic processes that were needed to finalize these arrangements took the extra time. Whether it needed to hire, maybe a cabinet approval or some other higher government authority approval, it just took a little bit of extra time to get those things through. And so we looked at this and we said, okay, how can we make this leaner? How can we expedite some of this work? And so we arrived at a final draft of a memorandum of understanding around specifically piggybacking. And so that addresses the need, purpose, scope, and the barriers to getting through an efficient piggybacking process. Suffice to say, that's about to be wrapped up and finalized. We anticipate that to be done by the end of March.
Right.
So that will do a couple things. Certainly, that will drive or advance the innovation portfolio that I referred to earlier. So if there's somebody either in one of those Atlantic provinces who had an innovative idea and went to a pilot, for example, and was successful in that pilot, they could continue with that jurisdiction in that innovative stream or adopt that innovative product. The great thing about this piggybacking now, of course, is so can the other 3 Atlantic provinces quickly and efficiently, as opposed to having to wait another year to do its own individual pilot in each of those 3 provinces. So it really narrows down the timeline here and advances, a lot of good things in healthcare. So that's one thing. And then we have a list of other projects that once we get this piggybacking project up and running, there's another few there that we want to tackle. So look forward. I can see that collaboration going on for months and years going forward.
It sounds like the collaboration is in some ways opens up opportunity for innovators. So if I'm located in, I don't know, New Brunswick with an innovative solution and and it happens that it becomes very effective, that means all 4 provinces can access that solution in much shorter timelines than they otherwise would have had to have painstakingly go province by province, right? And we hear that indeed. We hear that a lot from Canadian startups and companies. It's just so challenging to work through all the many hurdles that each province uniquely requires. On the flip side, if we find ourselves in a major challenge, perhaps another outbreak of some type of an infection or a very significant supply shortage of a critical product, do you see the collaboration of the 4 provinces also playing a role in managing those significant challenges? You may not have been in that position yet, but I just thought I'd ask, is that part of this vision as well?
Absolutely. So one of the things we want to look at as well is, so one of the goals we have there, one of the things that's on that wish list is an some IT platform, some visual, some digital service that says, I know what New Brunswick has, I know what Nova Scotia has, so on and so forth. So that visibility, I think, will go a long way. So that's the vision to certainly help with that. Outside of that, I think when it comes down to these sorts of public health emergencies, it's people. So I think the relationships are very, very strong amongst this core group of individuals. I think we can have mobilized quickly, and depending on how advanced our digital platform may be by then, certainly not looking for anything advanced, just some visual indicators of maybe it's a dashboard of who has what in each province. But depending on how advanced that is, certainly I feel 100% confident that this group, based on collaboration to date, will either look and share and help each other get through that challenge for sure. So many benefits to doing this.
You've raised so many incredibly important points, and that Canada really struggles with, but it really sounds like the Atlantic provinces are figuring this out. One is visibility. What do we have? Where is it? And who needs it the most, right? That's such a fundamental focus of supply chain. And just having that level of visibility in a group of provinces is just such an important strength that otherwise we just don't see in the rest of the country. In fact, we don't see it in many countries. I don't think it's unique in Canada. But to your point, what that transparency really also achieves is the trust and the openness in the relationships. If everybody has the same access and has agreed upon what data are we sharing with who and how do we use it, that relationship building and that collaborative strategy of managing whatever is in front of you becomes all that much more responsive and agile. and working, as a team because you're all facing the same challenge, presumably. Have I got that right, Tony?
100%. I think there's lots of knowledge
Yeah.
about the importance of resiliency and
Yeah.
and sort of the major categories that contribute to resiliency. And
Yeah.
I think to your point, it comes down to people and
Yeah.
relationships as well. And like I say, the collaborative
Yeah.
opportunities. So, how do we achieve that? So the challenge is turning that knowledge, I think, conceptual or otherwise, into practice. Let's make this pragmatic.
Yes.
Let's try to make this,
Yeah.
I know the sayings are pretty standard, don't boil the ocean and all that sort of stuff. But basically, right down to the absolute KISS principle. Let's just say,
Yeah.
guys,
Keep it simple.
what if this happens? Let's just throw that out
Yeah.
there. And then, can we
Right.
toss that around a bit and see what makes sense? And certainly that's why I think we're looking forward to working with you at a future date on
Yeah.
your resiliency
Yeah.
toolkit and the great work
Yeah.
that Scan Health has done on that resiliency toolkit. I think the Atlantic Canada group can help. We're absolutely more than willing to help. Kick the tires, maybe pilot
Yeah.
test some things, and help where possible to make that as pragmatic as possible. Yeah.
Yeah, thank you, Tony. There's no question that collaborative model and data-driven decision making that goes with it. What do we have? What do we need? How do we work together? Is a much more resilient strategy than every province going it alone, competing with every other province in the country and hoping for the best, which was, of course, what we ended up doing in COVID, which didn't work all that well. The other thing that is, I would say, really unique and interesting about your work in the Atlantic provinces, but Newfoundland and Labrador in particular, is how the many challenges of supply chain are impacting a large number of rural and remote communities. You have many communities around that, shoreline of your province, and of course, Labrador, very remote and small communities. Can you share a little bit about how you are supporting relatively unique populations managing during times of either shortages or disruptions or just not having what they need to make sure a patient gets care? Can you give us a sense of what are some of the twists and turns, if you will, that you've been having to find yourself managing, given all four of the provinces have a pretty substantial number of rural, remote communities?
No, absolutely. And there are some disparate
Yep.
areas here in the province, large coastline and so forth. You mentioned twists and turns, so I will start off with an example of a twist and a turn.
Yes.
And
Okay, great.
that is simply maybe revert back to the weather for a second, but there's an
Yeah.
area of the province in terms of supporting and delivering products to rural remote areas. There is an area of the province, I don't know if everyone in Canada may know about this one, but it's called the Wreck House, and it's on our west coast, and infamous for very, very, very high winds in the area of 160 to 180 kilometers an hour.
Oh,
So if you
wow.
have, transport trucks have been off the province or off the road and all that sort of stuff. So we have had examples where, unfortunately, that has happened. So that is certainly one unique twist and turn that has
Yes,
happened
and
before.
both have more than ways
And,
than one.
in more ways than one. But anyway, that's certainly one from a geographic or weather point of view. But
Yeah.
we also have others so we have just I suppose some metrics and you're right. Because of our large number of smaller communities, we have some programs within health supply chain that are directly targeted at these smaller or rural communities. For example, we have a community-based program. It's called the Special Assistance Program, where residents, a community-based population, receives medical supplies and/or food supplements. So we have about 8,500 residents signed up to that, and that's of course spread out provincially. So they would have to go to each and every house, so it's delivered to a house or apartment building or whatever the case may be. So that in itself has layers of complexity to it.
Wow.
To do it in a where possible, identify a critical path in terms of its transportation routes. The other things we're looking at there is to see if it would make sense to work with local stakeholders. To your point about local business, does it make sense to perhaps look at local business and say maybe they can serve as a mini distribution center, and kind of like a hub and spoke perhaps, or whatever the case may be, and not necessarily have to carry on to each individual home. So look at different ideas like that. We also see on the south coast of Labrador as another example, or even northern tip of Labrador up in Nain, Makovic, and so forth, where your ability to get supplies in there is limited. Some transportation providers, the only way to get in there is flight, right? So that really limits sometimes your ability to get in there. One of the things we find, though, is that in these smaller sites or the rural sites, because the deliveries aren't necessarily or cannot be as frequent as one would like, they sort of offer or sort of get more, stock up on buffer stock. And because of the lower volumes that are used, we're starting to see a little bit of wastage in certain areas. You know what I mean? So that's the other challenge around that. Certainly want to support healthcare, no question about that. And you have to be proactive in what you're looking at. But we find because of that, and in addition to, there may not always be in these smaller sites someone dedicated to supply chain who's managing this stock. So it could be that maybe not the fulsome process of inventory management practices are followed. It's only because of the fact that someone else is doing this on the side of their desk. So there's some of those challenges too around product flow and so forth. So, but anyway, so that's just a couple of examples of.
Getting supplies to all of the many rural and remote communities in Canada, and we are a very large landmass.
Yes.
Is that viewed as a real limitation for the supplier community in your experience? Is that an area where suppliers say, look, it's just too hard to supply, your many needs given the number and the breadth of rural and remote? Or is that not a challenge? It's just the procurement supply chain teams just have to be more innovative in working with those remote communities to make sure people get what they need. Do you think are you running into that challenge with suppliers, or have you solved it by, taking hold and ensuring that distribution works the way it needs to be?
I think it's working. So when we started this years ago, certainly there was over 40 suppliers that were sort of working the roads, we'll say, of this great province to get products to where they need to be. And that was done, many times through the entrepreneurship of these, some of these communities are, the population base, as a given order of magnitude, could be anywhere from 800 to 1,500, or say less than 3,000 anyway. So smaller communities, each one of them beautiful in its own right, but in terms of its location, certainly just the way this as you say, rock is organized. Sometimes they're pretty small and disparate locations. But certainly through those 45 or 43 suppliers, they've worked together to, many of those people are just entrepreneurs in their own region of the province. And we've tried to streamline some of that work through transportation efficiencies. And we find even that main supplier now is continuing to work with the suppliers in these remote and rural areas, mainly because of the fact that it's a challenge to get down there. But thankfully, we have active and qualified suppliers that are still willing to participate in supporting the health system. So I guess the answer is that, yes, sure, on one hand, it is a challenge, but because of the need, there's been an innovation portion or an entrepreneurial spirit here that sort of put their hand up and said, I'm here to help, and here's my ability to do so. So thankfully it's working, and the spirit of hard work is tried and true and evident here in Newfoundland and Labrador for sure.
I see it so often, that entrepreneurial jump in, figure out the solution. and teams working together is a real strength, I think, in your province, Tony, but likely, more than likely, all the Atlantic provinces. Just a couple more questions before we wrap up. You've been through many supply chain challenges over the last number of years. The pandemic was a significant number of those challenges. Looking forward in the next 5, 10 years, what do you think, or what do you see as the critical challenges, and never waste a crisis, the best opportunities we have in Canada and or even in the Atlantic to strengthen our supply chain resilience? If you were to identify one or two of those, where would you say our greatest opportunities are based on all the things we've learned to date?
Well, there's certainly, I think, and from a resiliency or an opportunity point of view, it's the digital platforms, right? So again, to support that visibility piece, to be able to say, let's connect Newfoundland and Labrador Health Services to its supply chain and all the stakeholders in that supply chain. So it's distributors, it's manufacturers, it's who's taken the materials, the raw materials out of the ground, and let's just see what's happening there. I think once you know that, you can plan for it, right? And you can, if you have an understanding, we do have systems in place now that sort of monitor what's happening globally, geopolitical risk or weather events or whatever the case may be. And that's a fantastic tool. It's just that it remains at a high level. So we may know, for example, that, we've even just this week, we've heard about storms in Maine and the northeastern part of the United States. And certainly we've got a report that says, NLHS could be impacted by this, but that's probably the extent of what we know at that time. Right. If we could, sort of drill down a little bit more to say, oh, your stents won't be in, or your IV catheters won't be in next week. If we could match that up a little bit more concisely, I think that would really help in our planning. And then we can go and do, again, through a digital platform or through that collaboration with our Atlantic partners or anyone else in Canada, say, oh my gosh, this is not coming through. Can we now, because it's all about the patient, we don't want to cancel surgeries. We don't want to, have a negative impact there. So I think that's one key thing for sure. And just to be able to say, is there like a early warning signal that says, who's up on the masthead looking out over at the sea and saying, oh, there's a storm coming, so who's doing that, right? I know we try to be as proactive as we can, and there are some tools for that, but it still feels we're a little bit on the reactive side when it comes to this stuff. So it's technology will play a role. I know AI is certainly in predictive analysis and all. Very, very important. Very, very important for us to learn more about that. If you could have maybe a solid demand plan, so you knew. Like we're small in Newfoundland and Labrador. We are small, and even the Atlantic provinces are small as well, I guess. But together, we're about $3 or $4 billion in spend, right? In terms of the health system. So that says something, right? And if we could work with our suppliers and just, maybe create an accurate demand plan, maybe it's through AI, maybe it's through predictive analytics or whatever it means. But if we could say, hey, here's what we need for the next 1 or 2 years, or however long term you want to be, you could almost lock those products in. Start with the critical ones first, and maybe work your way down. But so just again, collaboration with other members of the supply chain. So I think that would go a long way. Right?
Yeah, there's so many pieces to that. The data platforms that give you the much more granular level of, okay, there's a storm in Tennessee, and that's the four manufacturers that produce the following list of products. That's what you should prepare for. That level of granularity in terms of data, we're not really there yet.
Not quite. No.
But if we were, what I think you're getting at, which is the opportunity, is much more proactive. And if you had that data, that's where AI could offer you those predictive alerts and tools, the vision from the masthead. But without that level of data, AI is not going to help you much because it would have data feeds AI tools, right? And that Yeah, that data and that platform that's much more global than local is likely what I'm hearing is really where that future opportunity is.
And there's other things too. I mean, like I think we'll continue going forward, having our, everyone, I think, shares a financial constraint. I mean, we're
Sure.
healthcare budgets are tight. Those are sort of standard sort of
Right.
challenges. And I know we've all have our IT
Right.
limitations and that sort of stuff. But I think too, you can work around that and be creative.
Sure.
And,
Sure.
even things like, a sourcing strategy like value-based procurement. So,
Yep.
that focuses on outcomes. So
Yep.
it's more tangible, it's measurable,
Yep.
and then again, and if anyone that's working on a value-based procurement, then there's that planning function that occurs with that. So you know how to measure it, you know what products are required for that. So that then impacts certainly positively patient
Yep.
outcomes, right?
Yep.
So, and then whatever goes into those outcomes, there's almost a recipe box that says, okay, in order to make this outcome happen, we're
Right.
going to need this list of things,
Yep.
and then that supplier collaboration then will I
Right.
guess help proactively get those products in on time to be able to achieve that outcome. So anyway, so those sorts of things I think are all, like outside of the normal constraints that we all deal with every day,
Right.
like I say, IT and money and weather and whatever. There's a lot of things that can be done
Right.
to ensure that the resiliency of the health system remains as best as possible.
You raised really the fundamental center point, if you will, of supply chain being it is about those patient outcomes.
Yeah.
And that opportunity, the platform and the data is one piece of it, but linking that for the suppliers to patient outcomes. Start with, okay, we need our patients who need cardiac stents, just as an example.
Yeah.
Let's back up through that supply chain processes to make sure it's never delayed, it's always available when and where it's needed. Creates a whole different mandate, perhaps, and really set of objectives that in fact are measurable, where suppliers become part of the backbone of the health system, working very closely with the delivery of these services, making sure that every patient, wherever they are and when it's needed, those products and supplies are really available. It is such a critical mandate, and yet it hasn't always been front and center in supply chain sort of strategies, but I think Canada is getting much closer to that focused role of supply chain in driving the quality and safety of patient care for pretty much all Canadians.
Absolutely, and I feel that your point before about where supply chain is, and I think we're seeing much more sponsorship
Yeah,
at the executive level that helps
yeah,
see. I talked about the backbone, and as you did as well, but we see that actually that mandate being recognized or acknowledged more
right,
amongst those that probably in the past traditionally may not have noticed that.
right,
And they see the real value of the input of a supply chain activity. So that's very, very encouraging. And
yeah,
to continue to promote supply chain as a strategic function
right.
and have that voice, as we say, at the executive table or whatever level is required for influence and decision making, I think that's a very encouraging sign. Then you can adopt these things and get support
Yeah.
for data platforms or whatever the other activity is. So it's coming and it will come. Yeah.
No, there is no question, and I would suggest that your very impressive work in the Atlantic provinces and Newfoundland and Labrador in particular is really a phenomenal opportunity for all Canadian provinces, territories to have a look at and learn from and create those systems and collaborations and data-driven platforms, if you will, that are going to work for all parts of the country, not just those front runners. So, Tony, our warmest congratulations on this very impressive work, and we are ever so grateful at Scan Health to have a chance to work with you and your colleagues right across the Atlantic provinces. And to your point, we have much work to do, but driving with that very clear mandate to contributing to very strong patient outcomes that Canadians can be proud of, I think is such really a critical role of supply chain teams right across the country. So thank you so much for sharing those insights, those examples, and really helping people understand those nuances and why this supply chain strategy is so much a backbone of healthcare systems in Canada. So grateful for your time today. It has been amazing having a chance to share this work with everyone.
Thank you, Anne, very much, and I appreciate the opportunity.
It was wonderful. Thank you, Tony.